I think I'm excited to talk about a very nice topic that's not only foundational to our health, but also deep to many of us. It's about healthy eating. I must do a small correction. Yes, I did my clinical nutrition fellowship in Canada, but culinary medicine is my passion, and I had some exposure, but all of the fellowship is mainly about clinical nutrition. Um, yeah. Okay, let me start today. Let me start today with a question. Do you know about this Sardinia, Okinawa, and Loma Linda? These are the cities in the globe, and which they have something in common. So these places, along with few others around the globe, they are known as blue zones, right? And these are the regions where people live significantly healthier. They live significantly longer. In fact, many live around 90 years, 100 years. There are centenarians in those areas, which surprisingly, they live longer, but they live healthy and happy too. So they surprisingly they have very low levels of chronic diseases and heart disease, diabetes, and cancers. And especially they are not. It's not. These areas are not high tech inmates, and also they are. They do use all the natural things, and these are not genetically isolated cohorts as well. So why these people in several regions in the globe they have high longevity? Um, Yes, longevity blue zone has been identified as an area where the population is characterized by an exceptional longevity compared with neighboring regions. There are so much of research papers and studies they have done. Why do these people are having a good, happy elderly life? And this is the secret. I would like to summarize this slide for you. You can see the right corner. You can see that's Okinawa in Japan. This village, that's one of the islands in Japan. They have the world's longest living women. And the other picture is from Spain, and they have the longest, the best quality of life people. Even they live very long. These are the secrets and whole food they usually use plant-based diet, right? And they are the other thing is in Okinawa, hari butch, like there's a term that means they eat until 80% full. They don't eat until they the full stomach. They eat 80% full, and they eat whole food plant-based diet. And they active longer, and they have deep relationships. They sing and they do meditations. They spend on joy. That is the secrets of those people. Yeah, these communities, in terms of diet, these communities primarily consume vegetables, legumes, fruits, whole grains, nuts, and seeds, and minimal animal proteins. Yeah, minimal animal proteins. And so it's healthy eating is not just about nutrients, so it's about the lifestyle. So, these people, these you can see these caravilla and these orange. These purple sweet potatoes, they are antioxidants, and they minimally use processed food, simple sugars. They eat, if you just Google and just see the YouTube, what are the documentaries of these areas, it's very nice. And let's keep these principles in our mind during this session. And I have limited time, so I'll just run through the most important slides. Today's the objectives I have. I'm going to give you 8 principles, 8 take-home messages. At least if you can keep one in your mind, that's enough. So one is to improve your. I'll talk one by one when I'm going through the slides. To improve your evidence-based nutrition knowledge, and the second is to increase your dietary diversity. And thirdly, it's to use high quality carbohydrates. And the culinary strategies to low glycemic index. And the fifth is avoid highly processed and salty and fatty food. And six, to reduce excess sodium and then prevent the risk of stroke. And then finally, how to increase 2 points from your Mediterranean diet score. Yeah. As we move forward, let's take a quick look at this bigger picture. This is Sri Lanka's country profile in CD 2018. You can see 34% of total deaths, the mortality, it's due to cardiovascular diseases. It's still remain the number one leading cause of hospital deaths for more than a decade now. And this is not just a statistic, and it's a call to action. So we might be having these risk factors among us. This is an alarming thing that I'm going highlighting this over and over. Today's talk will be depend on these factors too. So moving to the next slide, the risk factors and related deaths. This is the global figure. You can see number one, number of deaths related to these 17 leading risk factors in United States. In 2016, the number one cause of death is diet. Initially, those cause of deaths were smoking and risk factors, but unfortunately, the diet has come as the most important dietary risk factor for these non-communicable diseases. So the poor diet now, it outranks smoking as a leading cause of death globally. Yeah. This is our figures. 1 in 3 adults, we have hypertension, and 35,900 patients, cardiovascular disease deaths in adults in our country, according to the hypertension profile 2023. Out of that 35,000, 50% cardiovascular deaths attributed to hypertension. So it's a big thing, how to find these risk factors for hypertension and how to combat the future non-communicable diseases. If you take this hypertension, these risk factors, there are 5 risk factors they have identified. Out of that, I'm highlighting just 3. And actually, my main concerns are two risk factors. One is mean population salt intake in adult is 11, which has to be less than 5. We are consuming salt, double the recommendation. And the physical inactivity in adults, it's 29% physically inactive. So 1 in 3 is physically inactive, and 11, we use double the amount of salt in our diet. So this is the STEP survey in 2021, how we are eating the vegetable and fruit consumption. 68%, all adults in our country, we consume less than 5 servings of fruits and vegetables a day. And salt intake, according to the STEP survey, it's 14.2 grams for participants in this both adults and male and female, both all the age groups in adults. The physical activity level, furthermore, it's a 34% responded. They did not adhere to the physical activity recommendations of WHO. Yeah. Coronary artery disease that begins with progressive endothelial injury. There's inflammation going on, there is oxidative stressors, and these oxidative stressors will be exacerbated by dietary factors as well. So these arteries are repeatedly injured with unhealthy diet. This is the endothelium. This is the formation of atherosclerotic plaque formation. Since the diet is related to my field, it's my discipline, I would like to just highlight only the dietary factors here. The oxidized animal products, trans fat, free radicals, uric acid from animal products, high fructose corn syrups, phosphoric acid in beverages, and oxidized cholesterol, everything this will damage the endothelium. What happens is then when the endothelium is damaged, they form foam cells, and they produce reduction of nitric oxide, and then later on that can cause atherosclerotic plaque formation, and the oxidized cholesterol go into the body, and they form another inflammatory reaction later on, come up with myocardial infarction and stroke. So like this, I really want you to just imagine, just summarizing this part, cardiovascular disease is one of the leading cause of death, and hypertension is a major risk factor. So please try to find whether you are at risk or not, right? Next, I'm moving to my first take-home message is to improve your evidence-based nutrition knowledge. Dear doctors, the public trust you the most for the nutrition advice. This is proven over and over, both in Sri Lankan studies and even in overseas. Yes, the public trusts you the most for the nutrition advice. The general public considers medical doctors among the most trusted source of nutrition-related information. And also that's the reason we should become the part of the solution rather than becoming a part of the global NCD. So we studied nutrition during our medical faculties. Then after that, we are working in the various fields. But the evidence-based things about food and nutrition is, I think it's in a lower level. But we can improve, and we are there to help. Now the researchers say that even though it's in the medical curriculum, even though it's taught, we really now need is the will to put the knowledge into the practice rather than having the repeated lectures. And the doctors are trusted and influential sources according to this 2018 Food and Health Survey. 78% indicate making a change in their eating habits after a conversation with a medical professional. So this is important. Why I'm highlighting this over and over is the knowing the proper nutrition has two advantages. One is for you and your family. The other thing is to improve your patients' outcomes. The next take-home message is to increase your dietary diversity. This nice study that examines dietary diversity and food patterns of Sri Lanka in marginalized communities, there's overall low dietary diversity in both in rural areas and urban areas. If you just see in a green color shows in rural areas, the comparatively, they eat more vegetables, more fruits, and more nuts and seeds, and more lentils. But if you compare with urban, all these vegetables, fruits, and everything is lower than the rural, but their dairy consumption, fish consumption, meat consumption is higher. So we are mostly in this urbanized area. So this is one study, and also it's proven in the STEP survey in 2021, the vegetable and fruit consumption is 68%. We are not consuming at least 5 servings a day. Yeah. Why we always ask you to increase vegetables is phytonutrients. It's phytochemicals. These are found in plant sources that really helps us to improve the anti-inflammatory effects. The major things are carotenoids, flavonoids, and phenolics, which is, there's a nice study. They showed that they investigated the total antioxidant content of food, more than 3,000 food, beverages, spices, and herbs and supplements worldwide. And they found that dried herbs and fruits, they have potentially excellent sources of antioxidants. This is one of the things that I'm always promoting to my patients, as well as in my blended feeds, and even to all the curative sector. We need to really go into this antioxidant thing. Take all the colorful vegetables and fruits to your diet. This table shows, just compare your plant-based foods and animal-based foods. The amount of the mean antioxidant content of these two varieties there's a drastic difference. If you take plant-based food, they have very rich antioxidant profile than the animal food. So they have very good effects as well. And this is some analysis about nuts, legumes, and grain products. Again, sorry, I couldn't add Sri Lankan data, but this is I received this from this article. If you take walnut, if you take these very rich, the walnut had the highest amount of antioxidant out of these grains and legumes here. What are the carotenoids? Orange. These are the carotenoid food are like yellow. It's orange. It's in red. and the orange pumpkin, carrots, yellow sweet potatoes, papaya, and mandarin. We can easily find these things. At least have one a day, one color a day. Flavonoids, it's found in green and white and the purple color fruit and food. Usually we can nicely have our greens at home and you buy, but you can grow spinach, green leaves, olives, cabbage, lettuce, broccoli, and this okra and other green herbs. It has very rich in antioxidants. Apart from that, this guava is one of the richest source, as well as amberella is one of the richest source. So when you have this food, what I always ask you to take this food and preserve that in the maybe in the deep freezer, maybe in the freezer, and make paste, and you can cut fruits and keep it in the freezer compartment. When the season is there, it's locally available, it's cheaper, so you can use it throughout the year. And the studies, they have found the variety in fruits and vegetable consumption and the risk of lung cancer. In this European perspective, they have found this this is reducing the risk of lung cancer, and this effect is independent from the quantity of consumption. According to this study, eat whatever the amount you can, even the smaller, even the high amount. That's okay. Just start at least with something. And this study, they showed dietary flavonoids and cardiovascular disease risk, and they nicely show that there is a dose response about flavonoid intake and your cardiovascular risk. And if you eat at least 400 grams a day, you can have a significant effect of cardiovascular risk reduction as well as a stroke reduction. But these are studies, but we need to do a randomized control trials just to prove the everything in a better way. But I'm just taking good examples for you to just to brainstorm. Yeah, we can practice this antioxidant thing even in the hospital, and I always do. We use antioxidant blends when we make blenderized food. We try to make, but this has to be done with a clinical expertise, because there are conditions that we can't use much fiber. But in general, what we do is in a blended feeds, I add antioxidant flavors to the food, and planning to do some studies with that. But I have already started that. The other thing is why I'm highlighting you to have high potassium and low sodium in your diet is it's also proven if you have higher sodium to potassium ratio in your diet, it is associated with significant increased risk of CVD. That means higher the score, the sodium divided by potassium. If you have a high score, that means you have a high risk. So what we need to do is to reduce sodium as well as to increase potassium in your diet if you are healthy. And everything, what I'm talking here is to the healthy population. If you have any kind of disease, your advice is different. The potassium, it's mainly controls your systolic blood pressure. It changes your vascular tone, and the amount of potassium that is needed a day is different from your age and according to your sex. And these are the good sources of potassium in our diet. If you take coconut water, if you take anamalo, then wild yams, and then even lotus root, ambul bananas, even cassava leaves, pistachio, they have very high sources of potassium. So if you are a mother or a father, if you are looking after your parents, if they are healthy, try to have this potassium rich food in your diet. It's not excessively, but just have this concept in your mind. And usually what happens is if I ask something in the presentation, they start from the day, from tomorrow itself, to start high doses of it. No, it's not the message. Have the concept in your mind, and then balance it with your day-to-day activities. So if you're selecting more plants and if you're selecting more vegetables and fruits, just embrace whole plant foods and aim for good diversity and use food as medicine. The novel concept is food as medicine. Yeah. According to the food-based dietary guideline, we recommend to have at least 2 vegetables, 1 green leafy vegetable, and 2 fruits a day. The minimum of 400 grams of as a weight, vegetable, green leaves, and fruits daily. This is a recommendation for adults in food-based dietary guideline in Sri Lanka. Yeah, I just added this. We are ranking one of the top biodiversity countries with a very good biodiversity. We have a very nice over 700 plant species. We have very good diversity in rice, cereals. But when I see patients, they eat just potatoes, beans, paripu, and then a little bit of gotukol, and it's a monotonous food that you're eating. I just added this just to give you some sort of insight. Grow things in at your place and buy different kind of plants, and then plan your meals at the end of the week, and then you will have a good diversity throughout your next week. My next take home message is to use high quality carbohydrates in your diet. Most of the goodness in grain is in the outer bran layer and germ of the seed. So whole grains can contain up to 75% more nutrients than refined cereals. What happens when you remove this bran layer and the germ layer? You can see the bran has fiber, B vitamins. The germ has B vitamins, vitamin E, and phytochemicals. Everything is getting destroyed. You will just get the endosperm. You will get carbs. You will get some proteins and some vitamin B. So just try to have the whole food, and that's very important. If you see the right side, you will see how much nutrient is lost when the food is processed. Fiber, almost 75% is destroyed. Protein, 25%. Sorry about that. The last is B group. It's 99% is lost. Potassium, 70% is lost. So if you just eat just processed rice, processed bread, processed everything, so you will definitely miss all these nutrients. Yeah. What are the high quality carbohydrates? Carbohydrate is not only coming from piste or palm. So it's always there from sweet potatoes. You can have yams, you can have cowpea and mung chickpeas, even vegetables like beetroot and carrots, whole grain pasta and noodles. You don't need to stop all the pastas and noodles. Yeah, there are good varieties whole wheat products in the market now. I don't know about the availability, but it's coming up in the market in even here. And you can have corn and whole wheat couscous and quinoa and those stuff. Yes, the next this my message is to use high quality carbohydrates always. This study shows energy and nutrient intake among Sri Lankan adults. We consume as a proportionally more carbs, 70%. It has to be 45 to 50%, but we consume a lot of carbs. And out of this 70%, it's mostly refined. Moving to the next third strategy, it's culinary strategies for low GI. This is one of my favorite area. Yeah, we have cooking methods. We have culinary steps to reduce glycemic response of food. Very good article. If we process any food, first I'm going to give you some 7 points. One is if you combine food. Use mixed meals. Don't eat carb alone. If you are having diabetes or pre-diabetes or obesity, always combine a starch with fiber or a protein or fat. So it will reduce the mixed meal, reduces the glycemic response. The next one is consumption order. Eat vegetables and protein first, and then start your starch. That is also proven to reduce your glycemic response. Third one is dressings. Add vinegar and acetic acid or any dressing, because if you have an acidic medium, that will reduce the gastric emptying. If you eat a lot of more processed food, that your amount of acid inside that food is low. That's the reason why we are asking patients to combine this starch with some dressings, especially the vinegar or any pickle or something like that. So it is proven to reduce your GI. And the next thing is food integrity. Prioritize your solids and unprocessed food. Always eat whole food. And what happens if you do any processings, we disturb the food's original structure. we break down it into particles, and then we expose them to more digestion and we facilitate more absorptions, and we alters blood glucose. So if you eat the whole food without less processing, and it's good. As an example, if you take corn flakes, or if you eat corn flour versus corn, it's a flour is not good because it's small bites. We facilitate absorption. So it's therefore important to consume food that preserve their structure and integrity, prioritize the whole food. The next concept is conservation and cooling. This is an interesting one. If you promote starch retrogradation, I'll show you this. What happens if you cook starch? You have starch when you cook. We have amylose bonds and it gelatinizes. And then starch is gelatinized when we give any thermal treatment like heat, maybe water, maybe pressure. So then if you cool it for more than 12 hours, that molecule is the thing happens, like we call it retrogradation. So when this is happened, it converts this starch to resistant starch. Resistant starch is a fiber, type 3 fiber. So it's very good. So you are eating starch, but at the same time, you are getting a lot of fiber. So if you then if you take like bread or rice, if you keep it in the fridge, then when you use it, you can either directly use it or you can reheat, but the temperature of reheating has to be less than 130 degrees. Otherwise, it will form the again, it will go back to the starch, right? So try to do this, practice this. Some of the other countries, they do this, even to the give advice to the diabetic patients as well. The other concept is level of ripeness of the fruits. Yes, use less ripe food. If less ripe food, they have starch, but it's less sugary. So you can have fruits, but if it is less or half ripened fruits. And then the cooking technique, it's also interesting. If you cook it a lot or the long duration, the amount of sugar getting absorbed and the glycemic response is higher. And amount of fluids or liquid added to the starch also matters. So the research show the rice to water proportion, it has to be 2 to 1. They compared that with 3 to 1 and 4 to 1. 2 times of water to 1 cup of rice, or 1 portion of rice to 2 portions of water. So they found that glycemic response is better in the where you use less amount of water. So add less amount of fluids when you cook starch, and then cook less. The less cooking, I would like to propose you to use something like pressure cookers, right? You can cook it very quickly. Yeah. So if you make your starch into the resistant starch, that lowers your GI, that improves your intestinal insulin sensitivity, that feeds your gut bacteria, and it's also good for the metabolic balance. These are all the practical dietary recommendations to reduce your postprandial glycemia. I have discussed almost most of this, but I'm moving because of the time. And the next message is to avoid highly processed and fatty food. Yeah, postprandial lipemia. Postprandial lipemia increase the risk of atherosclerosis, progression of coronary artery disease, and carotid intimal thickness. What happens if you eat a lot of fat? That increases triglyceride containing lipoproteins in the body. That goes to the epithelial linings, and they damages, they oxidize cholesterols and go into the blood, and that can induce inflammation. And they exchange our co-lipids like LDLs, HDL, and finally what happens is it can increase small dense LDLs, which is very very harmful to the body. So postprandial lipemia increase the risk. What happens? We are mostly in the fed state. There is no time to clear those triglycerides from the body because we eat Again, we do not give at least 5 or 4 5 hours to clear up. Again, we eat. We are always in the fed state. That need to be changed. And this is lipemic serum. There are so many other reasons you get, where you get lipemic serum, not only the high fat diet. And but I'm just concentrate on this nutrition aspect. If you increase, this is how it appears. If you eat very high fat, it increase obesity, increase LDL, high blood pressure. And this other thing is, if you eat a lot of high fatty food, it has bacteria, and especially the animal proteins, processed food, processed meat. It produces a lot of endotoxins. This endotoxin is different from plant-based food to the animal-based food. If when the bacterial cell wall dies, it releases these endotoxins. So it causes histamine release, myocardial depressants, platelet activating factors, and a lot of coagulation issues. And finally, it causes leaky gut syndrome. So because of this, the current literatures and societies in the globe, we are like promoting mainly the whole food plant-based diets. It's plant-based. It doesn't necessarily to be vegan, but it's plant-based. So everything is proven now. And finally, the lastly, how to prevent the risk of stroke. Stroke remains one of the most devastating of all neurological diseases, often causing death or gross physical impairments and disabilities. So, top causes of death out of CVDs, stroke comes first. Number one leading cause of death and disability. We must be having the risk factors too. So this is very nice, but the good thing is stroke is preventable by lifestyle modifications such as diet. If you see, dietary modifications would reduce the risk by 44%. Just compare that with antihypertensives, glycemic control, and statins, it's around 20%. But if you can go for a good dietary modifications, you can prevent the risk of stroke. But be mindful, this is not about stroke patients. This is about prevention of stroke, right? Yeah. The dietary fiber intake, also what it matters for the CVDs, both stroke and ischemic heart disease. It is estimated that the reduction in the risk is 12% for each 10 grams per day increment of your dietary fiber. So we eat very less amount of dietary fiber, but we are in a diverse country. We have a lot of food available, but we are not consuming. And the other thing is dietary fiber has anti-inflammatory effects too. There is inverse association of whole grain and fiber consumption with your chronic disease. And the preventing stroke with the diet, yes, it's proven. Finally, to reduce your sodium. As I said, the main sources of salt in our diet is coming from household diet. If you compare this figure with the globe, in other countries, mainly salt is coming from processed food. But in our country, salt is mainly coming from 70% is coming from our diet of our cooking. So out of that, 55% of people, they add salt to rice when you're cooking. Just stop it. Yeah, it's salt, it's an acquired taste. You can train your brain. Just don't add the rice salt to your rice. It's you have to stop that practice as unless you make a fried rice or some special occasions. And also salt is coming from dried fish and biscuits in our country. I'm not going to talk about homeostasis, just flavor. What we want is the flavor, not the salt or not the sweet. Flavor is not the taste. Flavor is a combination of everything. It's a combination of taste, combination of smell, environment, your trigeminal nerve stimulations, your texture of the food. So this is doable. I mean, reducing of salt is doable by enhancing other flavors. If you can add vinegar, if you can add billing, or if you can add other the umami flavor, right? The umami flavor, maybe you have not heard. This is a meaty flavor which is in meat, which is in soy, and which is in mushrooms, which is in tomatoes. And we can, if you add these things to your food, there are ways of cooking, and you can reduce the amount of salt requirement of the diet. So just practice the culinary, just practice cooking, and these things are doable. One of our patients are doing, we train them. It's a hard task, but it's doable. So finally, you have to take at least less than 1 teaspoon of salt a day per adult to, from all the sources, from rice, from food, and from drinks and everything. Excess salt causes all these issues. It causes fluid retention, stiff arteries, high blood pressures, and everything. Yeah. I don't think I have time to go through. So is it okay? Right. Yeah. Since you all are doctors, I thought of just showing you about a few clinical trials, which is interesting. You have heard about this dietary approach to stop hypertension. This is DASH, and then a DASH sodium trial, as well as Premier trial. And all these trials are related to hypertension, reduction of hypertension, and all with food. Yes. They initially did this study with 459 adults. They used people with systolic blood pressure about less than 160 with a diastolic pressure of 80 to 90. Basically, they used people with prehypertension, stage 1. Then what they did is they did it over 8 weeks. They randomly assigned these patients, these people, into 3 groups. One group is the control group. This is done in US. So they used standard American diet. The other group, they used the standard American diet, plus they added a little bit of fruits and vegetables. Third group is the DASH group, where we used low so healthy diet and grains, pulses, vegetables, and fruits. Yeah, this is what happened. Systolic blood pressure was reduced by average of 6, and diastolic pressure was reduced average by 3. And interestingly, while those on the fruits and vegetable group also had an improvement, but it is not statistically significant. Even without knowing anything about the DASH or Mediterranean or whatever, still, if you eat a lot of vegetables and fruits, you will get an effect, even though it's statistically significant, right? Yeah. Then they wanted to know, though, so moreover, the people with the stage 1 hypertension, their reduction of blood pressure is even more, and their reduction happened very quickly. Pick up your patients very early at a prehypertensive stage, start healthy diet, and you'll be able to see the responses even within 2 weeks, according to this trial. And then they wanted to see, okay, this is something, and we need to find what amount of sodium is really working for this DASH diet. Then they did this study, the DASH sodium diet, and they found the greater effect when combine your DASH diet with lowering sodium about 1500 milligram. Usually 1 teaspoon, around 5 grams, that has 2300 milligram. So 1500 is half a teaspoon a day. So if you can do this to your patients, to our patients, I mean, you have to monitor the patient as well, but you will get good results. Yeah, this is a DASH diet. I'm not going to go through the diet. It has grains or everything you know, but it has some measurements and it has SMART goal. Yeah, this is how they did the Mediterranean scores, and this is a very good thing, Mediterranean score, that I'm going to check with each of one of your score in the next slide. Your score is inversely associated with systolic blood pressure, CRP, fibrinogen, total serum cholesterol, BMI, and oxidized LDL cholesterol. So I prepared this for you, and if you can just scan this QR code by yourself and open that and do the scoring system and find your score, right? My take, don't get depressed with the score. It ranges from 0 to 10, but my intention is not to analyze your score, but intention is to increase your score by 2 points to lower your risk of chronic disease by 25%. Wherever you are, increase your score by 2, right? It has a lot of 10 questions. Do the questionnaire and then increase by 2 points, and do it with your friends, with your family, and spread the message. Yeah, finally, these are the important sources for you. And we have a food-based dietary guideline with us. and it's available in the freely available in the website. You can download. It's a very good source. And also the dietary reference intake for Sri Lankans. It has all the required RDAs, how much of sodium, potassium, magnesium that you need according to the ages, according to the sexes. And then there are two publications that is done in a World Health Organization: low salt recipes and salt snacks. Everything is freely available. I have personally involved in making those last two publications. And yeah, there are publications, there are resources. Only thing is to you have to act. Yeah, these are the I hope these are my objectives I wanted to cover. Improve your evidence-based knowledge, increase dietary diversity, use high quality carbs. You need to start your culinary strategies to low GI, avoid highly processed and fatty food, reduce excess sodium, prevent your risk of stroke, and increase 2 points from Mediterranean diet. Yeah, that's the end of the session. Thank you very much, everyone.